Did you know that there are some medications that millions of people take every day, but doctors refuse to use because they know the risks? Yes, these medications could be in your home right now, and you might be taking them without fully understanding the consequences. In this video, we'll uncover 5 medications that doctors never take, but they might already be part of your daily routine. Antibiotics. Antibiotics are powerful drugs used to combat bacterial infections. However, doctors tend to avoid their excessive or unnecessary use. Here's why. Bacterial resistance. Random and frequent use of antibiotics without a prescription leads to the development of antibiotic-resistant bacteria, which means that infections that could have been easily treated will become harder and potentially impossible to treat. Side effects. Some antibiotics can cause stomach disturbances or skin problems like rashes. Others may affect the good bacteria in your body, leading to digestive issues. Inappropriate use. Many people take antibiotics to treat viral infections like colds or the flu, but antibiotics do not treat viruses. Why do doctors avoid them? Doctors understand that antibiotics aren't always the appropriate solution, and they are only prescribed when a bacterial infection requires treatment. Therefore, doctors recommend using antibiotics cautiously to avoid bacterial resistance. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs, like ibuprofen and naproxen, are commonly used to relieve pain and reduce inflammation, but they come with some risks that make doctors hesitant to recommend them for long-term use. Gastrointestinal issues. Prolonged use or high doses of NSAIDs can lead to stomach ulcers and gastrointestinal bleeding, as these drugs affect the protective lining of the stomach. Kidney problems. Overuse of NSAIDs can lead to kidney damage over time, especially in people with chronic kidney disease or other health issues. Heart problems. Some research links the frequent use of NSAIDs to an increased risk of cardiovascular problems, particularly if used repeatedly and over the long term. Why do doctors avoid them? Doctors are aware of NSAIDs' risks, so they prefer to prescribe them cautiously and for short durations. In chronic cases, doctors often recommend alternative treatments such as physical therapy exercises or topical pain relief methods. Cough syrup with codeine. Cough syrup containing codeine is used to treat severe coughs, especially at night. However, codeine is a narcotic similar to morphine and comes with significant risks. Addiction. Codeine is an opioid, meaning it can cause physical dependence and addiction if used for prolonged periods or in large doses. Serious side effects. Codeine can cause excessive drowsiness, dizziness, and difficulty breathing, which can be particularly dangerous for elderly individuals or those with chronic illnesses. Unnecessary use. Often, codeine-based cough syrup is prescribed in situations where it's not truly needed, as mild coughs can be managed with natural remedies or non-narcotic medications. Why do doctors avoid them? Doctors avoid prescribing codeine unless the cough is severe and cannot be treated with other methods. Additionally, they limit its use to avoid addiction and related health problems. Proton pump inhibitors, PPIs. PPIs are drugs used to reduce stomach acid production, helping treat issues like gastroesophageal reflux disease, GERD, and stomach ulcers. Common drugs include omeprazole and lansoprazole. However, prolonged use can cause problems. Nutrient absorption issues. PPIs reduce the stomach's ability to absorb essential nutrients like magnesium and calcium, increasing the risk of bone weakness or fractures. Increased infection risk. Lower stomach acidity makes it easier for harmful bacteria to enter the digestive system, increasing the risk of gastrointestinal infections. Overuse. Many people use these drugs for extended periods without realizing the long-term risks, making them prone to chronic health problems. Diet pills and supplements. Diet pills and supplements are widely available and often marketed with promises of quick weight loss or improved health. However, these products are not always strictly regulated, which raises concerns among doctors. Undisclosed ingredients. Some supplements contain hidden or undeclared substances, which can pose a health risk. These substances can include chemicals that affect the heart or liver. Interactions with other medications. Supplements can interfere with other medications a person is taking, increasing the risk of side effects or making the medications less effective. Lack of sufficient evidence. Many diet pills and supplements lack strong scientific evidence to support their effectiveness, making their use either pointless or potentially harmful. Each of these medications has its benefits, but they also come with risks. Doctors avoid overusing or unnecessarily taking them because they understand the potential side effects. Educating people on responsible medication use is essential to maintaining the community's health and avoiding long-term health problems.